Hello, Maryland. Hello, PGCC. Well, it's good to be back in PG County. Give it up for one of the hardest working, most effective governors in the country, Governor Martin O'Malley. Well, it is great to be with all of you here today. I love you back. It's wonderful to be here. Wonderful. We also have a few folks who work so hard on behalf of the people of Maryland every single day. Senator Ben Cardin is here. Congressman Steny Hoyer is here. And Congresswoman Donna Edwards is here. And all of you are here. You know, sometimes you just need to escape Beltway politics for a little bit, even if you're just a mile or two outside the Beltway. Now, I know that a lot of you have seen some of the antics going on in Congress right now. So I want to take a little bit of time today to speak with you, the people who send us to serve, about something that is critical to our families, critical to our businesses, critical to our economy. And that is the reforms that we are making to our healthcare system. There's been a lot of things said, a lot of misinformation, a lot of confusion. But there are few things more fundamental to the economic security of the middle class and everybody who's trying to get into the middle class than health care. For a long time, America was the only advanced economy in the world where health care was not a right, but a privilege. We spent more, we got less. We left tens of millions of Americans without the security of health insurance. By the time the financial crisis hit, most folks' premiums had more than doubled in about a decade. About 1 in 10 Americans who got their health care through their employer lost that coverage. So the health care system was not working. And the rising costs of health care burdened businesses and became the biggest driver of our long-term deficits. But this has always been about more than just statistics. Everywhere I went as I ran for president back in 2007, 2008, every place I've gone as president, I would hear stories from folks just like you of insurers that denied a child coverage because he had a pre-existing condition like asthma, of cancer survivors that had to choose between their home or their health care, of small businesses who wanted to do the right thing by their employees but had seen their insurance premiums go up so high that they just couldn't do it anymore. And these stories were personal for me because I remembered my mom worrying about how she was going to deal with her finances when she got very sick. I remember the fear Michelle and I felt when Sasha was a few months old and she got meningitis and we raced to the hospital and they had to give her a spinal tap and we didn't know what was wrong and we were terrified. Never felt so scared or helpless in all of my life, but we were fortunate enough to have good health insurance. And I remember looking around that emergency room and thinking, what about the parents who aren't that lucky? What about the parents who get hit with a bill of $20,000 or $30,000 and they've got no idea how to pay for it? What about those parents whose kids have a chronic illness like asthma and have to keep on going back to the emergency room because they don't have a regular doctor, and the bills never stop coming. Who is going to stand up for them? In the wealthiest nation on earth, no one should go broke just because they get sick. In the United States of America, health care is not a privilege for the fortunate few, it is a right. And I knew that if we didn't do something about our unfair and inefficient health care system, it would keep driving up our deficits, it would keep burdening our businesses, it would keep hurting our families, and it would keep holding back economic growth. That's why we took on a broken health care system. That's why, with the help of folks like Steny and Ben and Donna, we got it through Congress. That's why we've been implementing it. That's why we are going to see it through. The Affordable Care Act is here. I don't have to tell you it was a challenge to get it done. A lot of special interests who liked the system just the way it was fought us tooth and nail. Then Republicans decided it was good politics to fight it, even though the plan we proposed drew on a lot of Republican ideas. But despite all the obstacles, the Affordable Care Act passed both houses of Congress. I signed it into law. The Supreme Court ruled it constitutional. Republicans in Congress have now voted more than 40 times to undermine or repeal it. Their candidate for president ran on a platform to repeal it. And at every step, they've been unsuccessful. Now, 5 days from now, on October 1st, millions of Americans who don't have health insurance because they've been priced out of the market or because they've denied access because of a pre-existing condition, they will finally be able to buy quality, affordable health insurance. In 5 days. Pre-existing conditions, whether it's back pain or allergies that were sticking you with sky-high premiums, those no longer will prevent you from getting affordable coverage that you need. That's going to happen in 5 days. Now, of course, the closer we've gotten to this date, the more irresponsible folks who are opposed to this law have become. Some of the same Republicans who warned 3 years ago that this law would be Armageddon. That's what they said, Armageddon. Now, they're threatening steps that actually would badly hurt our entire economy. Not because of the Affordable Care Act, but because of what they're threatening to do. Some have threatened a government shutdown if they can't shut down this law. Others have actually threatened an economic shutdown by refusing to pay America's bills if they can't delay the law. That's not going to happen as long as I'm president. The Affordable Care Act is here to stay. And so today, I want to speak plainly, clearly, honestly about what it means for you and for the people you care about. Now let's start with the fact that even before the Affordable Care Act fully takes effect, about 85% of Americans already have health insurance. either through their job or through Medicare or through the individual market. So if you're one of these folks, it's reasonable that you might worry whether healthcare reform is going to create changes that are a problem for you, especially when you're bombarded with all sorts of fear-mongering. So the first thing you need to know is this. If you already have healthcare, you don't have to do anything. In fact, for the past few years since I signed the Affordable Care Act, a lot of you have been enjoying new benefits and protections that you didn't have before, even if you didn't know they were coming from Obamacare. Let me just give you a few examples. Because of the Affordable Care Act, more than 100 million Americans have gotten free preventive care like mammograms and contraceptive care with no copays. Because of the Affordable Care Act, 3 million young adults under age 26 have gained coverage by staying on their parents' plan. Because of the Affordable Care Act, millions of seniors on Medicare have saved hundreds of dollars on their prescription medicine. They've been getting their prescription drugs cheaper. Because of the Affordable Care Act, just this year, 8.5 million families actually got an average of $100 back from their insurance companies because the insurance companies spent too much on things like overhead and not enough on actual medical care. Because of the Affordable Care Act, insurance companies can no longer put lifetime limits on the care your family needs or discriminate against children with pre-existing conditions. And starting on January 1st, they won't be able to charge women more for their insurance just because they're women. That's a good thing. So, tens of millions of Americans are already better off because of the benefits and protections provided by the Affordable Care Act. Like I said, they may not know why that rebate check came in the mail. They may not notice that they're not having to copay for some preventive care that they received, but they're getting those benefits. That's already happening. That's already in place today. It's been going on for several years. Those are the benefits of Obamacare, the law that Republicans want to repeal. Although it's interesting, when you ask Republicans whether they'd repeal the benefits I just mentioned, when you say to them, well, do you think it's the right thing to do to let young people stay on their parents' plans so they can keep insurance? Or do you want to prevent seniors from getting more discounts on their prescription drugs? Then they'll say, no, we like those. Those things are okay. So they don't like Obamacare in theory, but some of the component parts, at least those that poll well, they don't mind. But that's already in place. Now, here's the second thing you need to know. If you're one of over 40 million Americans who don't have health insurance, including hundreds of thousands of folks right here in Maryland, starting on Tuesday, 5 days from now, you'll finally have the same chance to buy quality, affordable health care as everybody else. And I want to break this down for you. I want you to know exactly how it works. The major reason why people don't have health insurance is either they don't have a job, or they do have a job but their employer doesn't offer health insurance, or they're self-employed. If you've ever tried to buy health insurance on your own, you know it is really, really expensive. It's even worse if you have a pre-existing condition, and up to half of all Americans have a pre-existing condition. See, the reason it's really expensive if you're buying it on your own is because you're not part of a big group. You're not part of a group plan. And what groups do is they spread risk between sick and healthy people, between older and younger people. And groups, because insurance companies want the business of groups, that's a lot of customers, they'll negotiate a better deal with a group than they will with an individual. So if you're on your own, you're out there trying to negotiate with an insurance company, they're looking and they're saying, well, you know, you take it or leave it, I'm going to charge you a whole lot of money. And if you've got a pre-existing condition, they'll say, we don't even want to insure you because we think you might get sick later on and we don't really want to pay, we just want to take in premiums. So if you're not part of a group, you're either uninsurable or you need to spend a small fortune on insurance that oftentimes is not very good. That's what's happening right now. The Affordable Care Act was designed to solve that problem. And here's how we do it. Starting on Tuesday, every American can visit healthcare.gov to find out what's called the insurance marketplace for your state. Here in Maryland, I actually think it's called marylandhealthconnection.gov. marylandhealthconnection.gov. But if you go to healthcare.gov, you can look and they'll tell you where to go. They'll link to your state. Now, this is real simple. It's a website where you can compare and purchase affordable health insurance plans side by side, the same way you shop for a plane ticket on Kayak, same way you shop for a TV on Amazon. You just go on and you start looking, and here are all the options. It's buying insurance on the private market, but because now you're part of a big group plan, right? Everybody in Maryland's all logging in and taking a look at the prices. You've got new choices. Now you've got new competition because insurers want your business. And that means you will have cheaper prices. So you enter in some basic information about yourself, what level of coverage you're looking for. After that, you'll be presented with a list of quality, affordable plans that are available in your area. It will say clearly what each plan covers, what each plan costs. The price will be right there. It'll be fully transparent. You know, before this law, only a handful of states required insurance companies to offer you instant price quotes. But because of this law, insurers in all 50 states will have to offer you instant price quotes. And so if you've ever tried to buy insurance on your own, I promise you, this is a lot easier. It's like booking a hotel or a plane ticket. And here's another thing about these new plans. If you're one of those folks who have a pre-existing condition, these plans have to offer you coverage. They can't use your medical history to charge you more than anybody else. If you couldn't afford coverage for your child because he had asthma, he's covered. If you couldn't afford coverage because you were told heartburn was a pre-existing condition, you're covered. If you're one of the 45 million Americans with a mental illness, you are covered. If you're a young adult or entrepreneur striking out on your own, you're covered. If you're a young couple who previously had insurance that didn't include maternity benefits and now suddenly you need some maternity benefits, you're covered. If you lose your job and your health care with it, you're covered. So all those things that were denying you coverage in the past, that were the cruelties of a broken healthcare system, on January 1st, when these plans take effect, no, hold on, I know what I'm talking about. You sign up starting on Tuesday. The plan will take effect on January 1st. And when these plans take effect, all those things change forever. Now, what about choice and cost? In states where the federal government helps run these marketplaces, the average American will have more than 50 different plans to choose from with different levels of coverage. And because insurance companies are competing against one another for your business, a lot of Americans will pay significantly less for their insurance than they do now. You know, premiums are going to be different in different parts of the country depending on how much coverage you buy, but 95% of uninsured Americans will see their premiums cost less than was expected. And many families, including more than 2/3 of all young adults who buy health care through these online marketplaces, are also going to be eligible for tax credits that bring the cost down even further. So let me be specific. Right here in Maryland, average 25-year-old. We got any 25-year-olds here? All right, so we got a few. Some of you raise your hand, I'm not sure. All right. Here in Maryland, average 25-year-old making $25,000 a year could end up getting covered for as little as $80 a month. $80 a month. Here in Maryland, a family of 4 making $60,000 a year could get covered for as little as $164 a month. It's the same story across the country. In Texas, average 27-year-old making $25,000 could get covered for as little as $83 a month. In Florida, a family of 4 making $50,000 could get covered for as little as $104 a month. And keep in mind, the government didn't set these prices. The insurance companies, they proposed these prices because they wanted to get in with these big groups, with all these new customers. The insurance companies are saying these marketplaces, this law will work. They're putting money on the line because they think it will work. Competition, choice, transparency, all these things are keeping costs down. You know, knowing you can offer your family the security of health care, that's priceless. Now you can do it for the cost of your cable bill, probably less than your cell phone bill. Think about that. Good health insurance for the price of your cell phone bill or less. And let's say you're a young woman. You know, you just turned. I'm interested in this because I got 2 daughters, right? Let's say you just turned 26. Let's say you can't stay on your parents' plan anymore. If you buy health care through the marketplace, your plan has to cover free checkups, flu shots, contraceptive care. So you might end up getting more health care each month than you're paying for the premiums. All told, nearly 6 in 10 Americans without health insurance today will be able to get covered for $100 or less. It would actually be 8 in 10 if every governor were working as hard as Governor O'Malley to make the Affordable Care Act work for their citizens. Unfortunately, we've still got a few Republican governors who are so opposed to the very idea of the law, or at least they're doing it for the politics, that they haven't lifted a finger to help cover more people. Some of them have actually tried to harm the law before it takes effect. But a lot of Republican governors are putting politics aside and doing the right thing. And they deserve congratulations for that. It wasn't easy for them, but you know, you've got conservative governors in Ohio and Michigan and Pennsylvania and Arizona. You know, about 8 Republican governors in all, they've decided to expand Medicaid through the Affordable Care Act to cover more people in their states. And millions of Americans without insurance will get coverage through these programs. So that's what the Affordable Care Act is. That's what all the fuss is about. We're giving more benefits and protections for folks who already have health insurance, and we created a new market, basically a big group plan for folks without health insurance so that they get a better deal, and then we're providing tax credits to help folks afford it. You would think that would not be so controversial. You would think people would say, okay, let's go ahead, let's do this so everybody has health insurance coverage. The result is more choice, more competition, real health care security. And one question people ask, how is it possible to do all this and keep costs down? Well, part of what we did was build into the law all sorts of measures to assure that the growth of healthcare costs would start slowing down, and it has. See, under the old system, doctors and hospitals, they were rewarded not for the quality of care, but for the quantity of care. They'd get paid for the number of procedures they did instead of whether they were working or not. Now there are